Okay, thank you so much. So again, good morning, everyone. And first of all, I would like to thank the organizers for hosting such an important event and for inviting me as a speaker. Today, I would like to talk about food insecurity that poses a major global challenge for all the societies. And I also would like to highlight the results of our large population-based study that focused on exploring association between household insecurity and obesity and looking at these issues from the gender disparities perspective. Here are my disclosures. And I would like to start from a couple of words about how do we define food security. Food security exists when all people at all times have physical and economic access to sufficient safe and nutritious food that meets their dietary needs and food preferences for an active and healthy life. The Food and Agriculture Organization of the United Nations describes food security as multidimensional that encompasses availability of food, access to food, ability to utilize food, and stability of food supply with regard to climatic, economic, social, and political factors. You can see all these four pillars of food security here. Food availability pertains to the supply side of food security and the physical existence of food in a sufficient quantity and appropriate quality. Once the food is available, households must have sufficient access to that food, and it's usually achieved through adequate income or some other resources people can utilize. Provided that food is available and households have adequate access, then food security requires that households can consume adequate nutrients and energy. And here we are talking about utilization. Finally, stability indicates the consistency of achieving the pillars of availability, accessibility, utilization, and stability. So basically, achieving food security requires that all these four pillars are being met simultaneously. Now let's talk about an opposite side of the spectrum. What is food insecurity? So food insecurity refers to limited or uncertain availability of nutritionally adequate and safe foods, or limited ability to acquire acceptable foods in socially acceptable ways. Food insecurity has a wide range of health consequences, and you can see some of those listed here. Those include, but are not limited to, overweight and obesity, macro and micronutrient deficiencies, poor physical health, poor mental health, as you can see depicted here, poor academic achievement, mainly for those kids who are residing in food insecure households, poor work capacity for adults, also a lot of violence, interpersonal violence, family violence, violence towards women are actually related to food insecurity. Premature mortality is also a very negative outcome of food insecurity that we can often observe in pregnant women and those who unfortunately deliver prematurely. So many other health consequences that are not listed here are also related to food insecurity, and we can see more and more kind of like falling under this umbrella as our studies move forward. Food insecurity is a major global challenge across the world. Here you can see the prevalence of moderate or severe food insecurity in 2021, according to Food and Agriculture Organization of the United Nations. So their estimates are pretty accurate, and here you can see that there are multiple hotspots in the world where up to 100% of people experience some degree of food insecurity. So the prevalence of moderate or severe food insecurity can reach 100%. At the same time, more recently, the situation is changing, and even developed countries such as Canada are not immune anymore to food insecurity. Here you can see the prevalence of, again, moderate or severe food insecurity. in females compared to males. And basically, in every single region of the world, women are unfortunately experiencing higher burden of food insecurity compared to their male counterparts. Those gaps are more pronounced, as you can see here, mainly in Latin America and Caribbean. Estimates are pretty much the same in Asia, but more recently you see that these gaps are widening. And in Africa, you can see all these estimates are rising in parallel, but globally, in general, across the world, you can see that unfortunately, women are experiencing higher burden of food insecurity. So this gender gap in food security has actually widened further as a result of COVID pandemic. So let's talk about food insecurity and sex disparities. So why women are especially vulnerable to facing food insecurity? Globally, within both developed and developing nations, women tend to have less economic resources, and here we are talking about lower employment rates, here we are talking about lower assets available for women. Usually women are less educated. Sometimes it's not the case for developed countries, but in the developing nations, definitely we see this trend pretty clearly. Women experience higher rates of gender-based violence. They also share a larger burden of caregiver responsibilities when compared to their male counterparts. And you can see that the largest burden of food insecurity is among those women who are single mothers taking care of their children and potentially having other dependents. Historically, women are disproportionately impacted by all these socioeconomic disparities that we just listed here. And here you can see some numbers. So in 2021, there were 126 million more food insecure women than men, compared to about 50 million more in 2019. So basically more than doubling this gender gap in food insecurity. Here are the results of a very elegant study performed here in Canada based on data from the Statistics Canada, done in 2021, definitely groundbreaking study published in 2021 by Canadian researchers that demonstrates that in Canada, up to over 20% of population is food insecure. As you can see, unfortunately, Alberta is on the top of that list. How food insecurity gets incorporated into the continuum of chronic diseases? How does it fit into that picture? So here you can see a very nice outline of, again, this pathological loop involving food insecurity in different chronic diseases. So when people or households are food insecure, they have constrained dietary options, and they would develop some compensatory strategies during food adequacy periods and during food storage periods. All of this can lead either to weight loss or weight gain as a compensatory strategies. And with added stress, it can often lead to the development or exacerbation of chronic diseases such as obesity, hypertension, and diabetes. Unfortunately, it further leads to reduced ability to afford appropriate diets, again, because people are getting sicker. It leads to poorer mental health and some other competing demands, which is adding stress further and leads to additional weight gain and poor control of some additional risk factors contributing to it. Eventually, everything ends up with increased healthcare expenditures, poorer employment, which actually exacerbates the food insecurity even more. And this pathological loop can be continuing without any disruption. Obesity in Canada is also on the rise, and the study we published in 2022, as you can see, shows that obesity prevalence in Canada increased by 23% between 2005 and 2017 and 18. And with COVID pandemic, we should see it increasing even further. Our study aimed at assessing the trends of food insecurity in Canada over the last 1.5 decades and its linkage to obesity. And we also wanted to see those associations through the lens of sex inequalities. We utilized data that were obtained from 7 consecutive cycles of the Canadian Community Health Survey from 2005 to 2017-18. We were able to include over 600,000 people with available BMI values, body mass index values, and those who were adults. We assessed food security status utilizing those questionnaires, a set of 18 questions describing the food security and food versus food insecurity situation in the previous 12 months. And the household was defined as food secure if there was none or only one indication of difficulty with income-related food access. Some limitations here, as you can see right away, because we know that sometimes food insecurity is not related to income. It could be outside of that dimension. Here are our results. So as you can appreciate from this bar chart, obesity prevalence among adults living in food insecure households was significantly higher compared to those who are food secure. And looking at the colored bars, here you can see in coral color for females and in blue color for males, we can appreciate that over 30% of women living in food insecure households were struggling with obesity, compared to 22% of females living in food secure households. But for males, food insecurity status didn't seem to make much difference, as we can appreciate from those estimates. What about trends over time, starting from 2005 to 2017 and 18? And here you can see obesity prevalence among Canadian adults residing in food insecure in these dotted lines versus food secure in bold lines household. As you can see, here in green dotted line, it's Canada-wide prevalence of obesity over time, over 15 years. And you can see that obesity prevalence increased with a statistically significant increase in linear trend, but magnitude of increase was much more pronounced among food insecure households and especially about females. So some results of logistic regression that we performed, as you can see here, females versus males, and some features associated with obesity. So based on the results of univariate logistic regression, you can see that food insecurity among females was associated with significantly higher odds of struggling with obesity versus males, where this association was basically not so pronounced. And when we controlled for other factors such as income, education, fruit and vegetables consumption, and physical activity, you can appreciate that this strong association between food insecurity and obesity remains strong among females. So this risk of obesity among females living in food insecure households after controlling for all these additional factors, it was about 50% higher compared to those females living in food secure households. But for males, we didn't observe much difference when controlling for all these factors. So here you can see our conclusions. So obesity was more prevalent among females from food insecure households, while opposite tendency was observed among males. This magnitude of increase in obesity burden among Canadians experiencing food insecurity over time is definitely concerning, and especially among females. And strong association of food insecurity with obesity among women and lack of such among men warrants action towards reducing sex inequalities and achieving best outcomes for people living with obesity. Going back to the global picture of food insecurity, what could be the solutions? And very nice report published by UNICEF in March 2023. It focused on prioritizing access to nutritious, safe, and affordable diets. They mainly talked about women and adolescent girls, but it could be actually appropriate to widen this approach worldwide and include basically everyone who is struggling with food insecurity. So implementing some policies for food fortification and ensuring free access to essential nutrition services, expanding access to social protection programs, and also accelerating the elimination of discriminatory gender and social norms. So thank you very much for your attention, and I would be happy to answer your questions.